Hello and welcome back to the Dr. Lean Body YouTube channel. I'm Dr. Brent Scroggins, family medicine physician in Conway, Arkansas. Been a while since I've done any content for the channel. Going to discuss vitamin D today. What is vitamin D? It's a very important nutrient that we all benefit from and need. It's a fat-soluble vitamin that helps with calcium and phosphorus reabsorption or absorption through the gut. Benefits our bone density and strength. Helps with immune functionality, so it decreases your chance of getting sick when you have good vitamin D levels. I definitely personally saw a lot of vitamin D deficiency in patients that were really sick in the hospital with COVID. Winter time is a time of increased viral infections. Part of this has to do with the lack of sun, and vitamin D levels tend to kind of drop in the wintertime. So the immune function seems to decrease during this season. So I think that's why we see some of the increase in viral infections when it's cold and dark, not as much sunlight. So vitamin D does definitely play a big role in helping our immune functionality. It has been shown in some studies to reduce cancer cell growth and cancer risk. In particular, colon cancer seem to have the most evidence. Also, some studies suggestive of benefits in decreasing breast cancer in women and prostate cancer in men. Having better vitamin D levels do seem to help. It does seem to play a role with cognition as we get older. Better vitamin D levels are associated with improved cognition and memory. So that is another valuable role that it plays. It's associated with decreased inflammation, improved cardiovascular health. People with better vitamin D levels tend to have less cardiovascular events. And it also seems to help a bit with blood pressure. Vitamin D deficiency is associated with higher blood pressure. And another thing that it seems to help with is mood. Vitamin D deficiency is more common in folks that suffer with depression. So folks that have better vitamin D tend to have better mood and mood stability. So what are the sources of vitamin D in the natural environment? The primary source for vitamin D production is our skin, with sunlight activation of vitamin D. Food sources where we get vitamin D from would be foods like salmon and tuna and certain nuts and seeds, mushrooms. They're good sources of vitamin D. About 20 minutes of sunlight per day seems to give you a good little boost in vitamin D production. Folks that have darker skin seem to be a little bit more resistant to vitamin D production. So just because you do get a lot of sun exposure, darker skin, when you have more melanin, that has been shown to decrease the production of vitamin D. So even some folks with darker skin tone and plenty of sun exposure need a little vitamin D supplementation to get their levels to optimal. Another source of vitamin D would be supplementation. Two different types that you will come across usually: vitamin D2, which is the primary source from plants, and vitamin D3, which is what humans use. Vitamin D3 has been shown to be superior at getting levels up and sustained in comparison to the vitamin D2. So vitamin D3 is definitely the way to go when you are trying to get your vitamin D levels improved. Go with a vitamin D3. Other things that help vitamin D3 to function nutrients would be vitamin K2, seems to help with D functionality, and magnesium seems to help. It's a cofactor in a lot of the reactions associated with vitamin D, so it's important as well. Vitamin K2 not only helps D to get calcium into the bone more efficiently, but it does help get calcium and keep calcium out of the arterial system, so it has been known to decrease calcification of your vessels. So vitamin K2 is a good thing to go ahead and supplement if you're going to do a D3 supplement. So I recommend a supplement that has vitamin D3 with a K2 as well as a magnesium, so that you don't have to take 3 or 4 different pills to get benefit. So that's some of the many benefits of vitamin D. I just want to kind of cover that. It's something that is not stressed enough, in my opinion, in medicine today, but something that's very important for many aspects of life and health. So hopefully you enjoyed the content, and definitely make sure you keep up with your vitamin D levels with your physician. There's a range of levels there. I would, just like other hormones, there's a suboptimal low range and there's an optimal range. So to get more of the benefits, I like to see levels around 70 to 80 all the way up to 100. And it is something that you have to be a bit careful with. You can get too much, which is going to cause some hypercalcemia as a primary side effect of too much vitamin D. It's kind of hard to do. I really haven't seen that in my career much, maybe once, but very high doses would be required for that. So pretty safe dosing for most Americans would be around that 4,000 to 5,000 IUs per day supplementation range. For some folks require much higher doses to get their levels up. There seem to be folks that are more resistant to vitamin D absorption through the gut. There's also some vitamin D receptor polymorphism that's present that seems to be associated with weight loss and resistance / obesity in the U.S. Then we can talk more about that in future videos. But again, shoot for that upper optimal end of vitamin D range when you have your levels checked with your physician. Definitely want to keep an eye on those.